Hello, everyone. Welcome to another episode of Residency Real Talk, where we bring the truth behind the title. Hello, I'm Dr. Himanshu, and today's episode is extra special because we are driving into a specialty that's equal parts clinical, cosmetic, and deeply compelling, and that's we call dermatology. And today, joining us is someone who isn't just practicing dermatology but brings alive with her infectious passion. That's Dr. Karishini. Hi, Dr. Karishini. It's such a pleasure to have you on the show.
Hi, Dr. Himanshu. The pleasure is mine.
It's like you're doing something different, right, from outside of the OPD. So I believe this session is going amazing. So, first things first, I just want to ask you, what inspired you to be a dermatologist? Was it your dream from the beginning, or something you felt doing dermatology during graduation? Like during your internship, you might got driven towards it. So, what was your basically what drive you for it?
To be really honest, I took dermatology because I wanted a good work-life balance. And usually we don't get that much exposure in our internship as such to know about the branch. And I feel more or less blindly, just because of the fact that it offers us a good work-life balance. Dermatology is one of the most like top chosen branches. So even for me, it is the same reason. It's not about the subject in the beginning, to be honest. Only because of the I think lesser work pressure. I think it is relatively lesser compared to the other branches, and it offers a good work-life balance. So that has driven me to choose dermatology.
Yes, as we all know, it is in like the top ranks of after NEET PG, people prefer dermatology just because they don't want a hectic schedule, doing night duties or something like that. So yes, it's somewhere it has a good work-life balance with dermatology,
Okay.
and yes, it has so much into it, not just dermatology, so much more into it. Like yeah, we'll be talking about it as we proceed ahead. So there's a myth among medical students that dermatology is clean and cool branch, and uh, but as I understand, it's like who studies it knows what actually is dermatology. It's like
Mm.
autoimmune conditions, genetic syndromes, even psychiatric overlaps. Like I fear genetic diseases a lot right from my second year, like pathology. So what do you have to
Yes.
say about it? Is it like what I still believe it's like cool branch, just all that
Yes.
glow after dermatology? So is it like that
Yes.
only?
So yeah, we do feel it is a very clean, cool branch until we encounter a case of pemphigus vulgaris or SJS. So that will be our like wake up call that you are in a serious branch. So initially, even when I've started my residency journey, so till OP it was fine, outpatient basis. But once first time I saw a pemphigus case, full blown pemphigus and very high severity, admitted in the ward, and then I had to manage. I felt okay, this is real, this is a like we are making a difference. Dermatology is not just about superficial things.
Yeah, not just making
Many
people
people,
beautiful and like the flawless
yeah,
skin.
it's
It's
not
way
just
beyond that.
about aesthetics.
Yes.
Yeah, many people told me like, what is there in dermatology? It's just all itching. They get only those cases. So I just want them to know that. So once we treat pemphigus vulgaris, full-blown pemphigus vulgaris case, it gives us a lot of satisfaction, and we see the SJS patient improving. So that gives a lot of satisfaction. So it is not at all clean
Yes, it
completely.
is. It is like I've seen people in leprosy admitting into ICUs also. So it is.
Yes.
It can be that serious from outpatient to it has like
Yes.
people can go to till ICU. So I understand it's not
Yes.
a cool and clean branch what people usually say. Even the
Yes.
non-medicos must be thinking, okay, dermatology
Yes.
treating acne and allergies and the skin, it's basically that for them. So but you know what actually is inside of it. So is there any
Clinical
advice?
dermatology is
Yes.
much more than that.
Yeah, it is. So is there any advice you want to give to our early PGs, whether clinical or academic, like what should
Yes.
they do, like right from the time they enter in their post graduation, or what you went through during your post graduation is which you thought
Yes.
like I should know this before joining the dermatology
Dermatology.
as a resident. Yes.
So we usually we take dermatology to be very light. We consider it as a very superficial subject, right? And we take for the reason of a good work-life balance. But to break the truth to you, it is that you have to read a lot. So there is a lot to read. So both clinical wise and academic wise, dermatology is very challenging. So that you understand once you start seeing the patients that even a very basic fungal infection case becomes very difficult to diagnose. So it we have to master the art of actually decoding the morphology of the lesions. It is a very visual subject. So I will only tell the newer joinees, all the PGs, that first try to decode the morphology of the lesion. Start from the basics. We get a lot of like the newer upcoming PGs. They are like they read a little bit of dermatology for NEET PG, and they directly try to fit in everything into one diagnosis. So it is like I myself got confused with the case of Hansen's. I thought it to be tinea in my first year, in my on my first day. So that's what we have to be very vigilant. We have to be very visually active. We have to understand the morphology. And the other part is the academic part where we have to go through a lot of literature because dermatology is still evolving. Whatever drugs were still under trials during my first year of PG, and now we are using it regularly. So it's very, very fast paced and very fast changing branch. So we have to keep up with that pace. So you should read a lot of articles, lot of new studies. You should do a lot of research as well during the postgraduate.
Like as we suggest, like as you said, like dermatologists rapidly changing. So I believe that happens with the drugs or the ointments that we are currently using. So resistance is growing day by day, and there are many fungal ointments, antifungal ointments that when I was around my third or fourth year, we used to see that people are getting treated by them. But today there is a huge resistance with them. So before going on further, I would like to know what is your say on it, like the resistance that is there.
So resistance not just antifungals, even the topical antibiotics that we are using for acne also. Now we are finding a lot of resistance. Now that could be one of the major factor which I would want to address also is the quackery, because dermatology is one field which is always heads on with the like quackery that goes on around, because outside there is a lot of topical steroid abuse, particularly in our country.
Yes, yes, I was about to say that. Like right away, people prescribe. Even someone goes to a pharmacy just to buy anything for
Yes.
you. They
For
typically give
everything from
steroids.
tinea to melasma, they
Yes,
are using steroids
yes.
over the counter basis. And there is emergence of new species of tinea actually. They have been named as Indotinae. So that is the situation of India, only because of these emergence of resistant mutants, which are mainly because of using OTC based topical steroids. So that is the situation of India actually. So it's time people get aware that they should go to the right physician. They should consult a dermatologist. So that is a very big rampant thing in our country regarding quackery. So that is one bigger problem.
Yeah, I've seen people with their fungal infections or the lesions. They've been there for years. They're like, okay, when the itching stops, I'm cured. But I've been like, when I was practicing clinic, so I used to tell them like, no, it's not just that the itching stops. You have to stop your antifungal. It goes on for long. At least we need 2 to 3 months to cure it because it's deeper into your dermis. So it is hard for people to like to make them understand. Even the educated people
We
ones,
do
yes.
tell about a lot of general measures to be followed, but I think the patient compliance is very less. They want a faster recovery, and for that they go for topical steroids or they go for alternative medicine. So all these do contribute to that emerging resistance as well.
Yeah, it is hard to make them
Yes.
understand, I guess. So, yes, as we move on, so uh, let's take things a little different perspective. So, dermatology is just about clinics anymore, as you said. So, there is research like telemedicine or aesthetics and
Yes.
dermatosurgery, which is still evolving. And it's like, I understand that there's just fellowships regarding it, not MCH or the super specialty we
Yes.
have, But it's like derma is now considered as it's not an end branch
Yes.
anymore. People wants to study after
Yes.
dermatology. They wants to add on like wings to their degrees. So what do you have to say? Like, even do you think about pursuing some fellowships regarding like you want to pursue after your
True, true.
residency?
So dermatology has a lot of subspecialties. So we don't have super specialty yet, but we have a lot of
Yes, yes.
subspecialties like pediatric dermatology or aesthetic dermatology or dermatosurgery. So
Mhm.
all these are booming up as I speak, to be really honest. So there's also a plan of super specialty in pediatric dermatology by one of the central institutes as well. So we might also get super specialty in dermatology in future. So again, it depends upon what kind of practice you want to do after your post graduation. So based on your needs, a fellowship is always good. It's always better to be, I feel, like into the research or studying more. It's always better. But I feel dermatology has this advantage of being an in branch as well. So even after your post graduation, if you're confident enough, you can actually start your own practice. The
You can be
fellowships.
independent soon. Yes, so like it is a branch which can make you independent
Yes,
soon. So not like
not
other
like other
branches. So it takes
branches.
time for you to, yeah, it takes
Yes.
time. So as a dermatologist, so I want to know how is your residency? So your PG time, all like those 3 years. So what was it like? You not just clinics, you had your personal time also, and what thing you want that you didn't pursue, you didn't do during your residence, you want your coming juniors to do.
Okay.
So I would like to know about that also.
My residency was the most satisfying period ever. I enjoyed my residency so much because I think that has to do a lot with our department. They were very encouraging. So they would not tell you should not do this or you should not pursue this. They encouraged a lot regarding whether it is research work, whether it is clinical work. So they were always there. Sometimes they used to learn from us. The consultants used to learn the newer things like dermoscopy or anything from us. And I feel our seniors, I think they actually shaped us because they taught us. They were our immediate teachers who taught us how things go about in the residency. And also we got a lot of support from seniors as well. And I personally, I was very active in my residency. So I would do things. I always wanted like any publications. I would learn things. I would pick up things. I would learn. I would do research on them. And I would go do paper presentations, poster presentations. I would actively participate in our conferences, state and national conferences.
So it helped you grow overall,
Yes.
like not you just you didn't restricted yourself just to the your
Studying or
OPDs
academics.
or your hospital
Yes.
only. Yes, so it was like way beyond than
Yes.
that. So I guess everyone should do that
Yes.
just to gain more knowledge and to live to live your residency a whole, I
Yes.
will say. So I suppose that now you've been a DigiNerve user, so I suppose it helped during your
Yes.
residency. Is there anything you want to tell to other residents, so how it can
Help.
help you or how it
Yes.
shaped your study?
So honestly, I took DigiNerve in my second year of post graduation when they just introduced dermatology. So at that time, I couldn't really understand because even I was not, as I told, I was more into the research work or anything, but I was not reading the textbooks. So I was little bit behind reading textbooks, like conventional method of studying. I was not doing. So
Yes.
and when I was listening to the videos, I couldn't grasp it immediately. But again, I've taken DigiNerve in my final year. So because that is my exam going year. But after
Yes,
with a
yes.
little bit knowledge foundation over dermatology, when I just coupled that with DigiNerve videos, it was like it was a very new. Uh,
A better work, I will say.
I've evolved so much because the way they were explaining,
Yes.
now I could understand it better. So I would say that DigiNerve we have to couple it after like the you got some foundation into the subject. It's definitely
Mm-hmm.
particularly I think you can start in your second year, and it's really helpful because they've compiled from all the books like all the, and even
Mhm.
recent updates. So everything at one place with a good
Okay.
visual diagrams. So for to make us understand better. But we do require a little bit foundation before we go through DigiNerve, because they all are like. Very I think big people, experienced people handing
Yeah,
out our
exactly. Good
lectures.
thought.
So
Yes.
so we have to keep up with that pace.
So any particular feature that is like, okay, this is what I wanted. It is helping me a lot, apart from the videos and the learning process.
I think MCQs. So in the video only, while we
Yes.
watch the video, we get some questions in between. So that is also the
Yes.
self-assessment questions are very very helpful.
Mhm.
So we will know whether we have understood the topic or not, and we can repeat it. So that is one very useful feature which I found.
Mhm. So yes, after all, yeah, so it's I'm glad to hear that Dajanav helped you during your
It
residency
helped me a
and
lot. I
somewhere
have
helped you
to
during
say
your
this.
exam.
So for my university exams also, so majority of the topics
Mhm.
I've actually studied from DigiNerve. I've made notes again actually, but majority, almost
Mhm.
80% of the topics I've utilized DigiNerve, and that actually gave me an edge compared to the like others. I would think
Mhm.
like that because I could complete the portion very faster and in a shorter time,
Mhm.
because for university exams it's a completely different ball game. And I could actually
It
like
is.
add
It
all
is.
that clinical points, the newer research
Mhm.
points in my answers. And I was able to score well, and I became the university topper of my state.
That's really good. Congratulations to you for
Thank
that.
you.
So okay, DigiNerve is helping people be toppers. So it's I am glad to hear that. So like before closing our session, so there's one twist in our podcast, and that is called rapid fire, and I hope you're not afraid of it. So
No, depends upon your questions.
okay, no, they will be very, I guess, subtle questions. They will be there. So one skincare myth you want to bust right now.
That we don't need sunscreen indoors.
Okay. I somehow had like, okay, I had an intuition that you will talk about sunscreen. Yes. I've been saying it to my fellows also. We need sunscreen when we are
Indoors.
indoors also. Yes. So these lights affects our
Yes.
skin. Yes. Any particular like sunscreen you want to tell, like, okay, the particular SPF that we should use while going
Yes.
outside and while we are
SPF
indoors.
minimum should be 30 actually. But now we have
Okay.
SPF 50 and even SPF 80 formulations also. So the more the better.
Okay.
So and a broad spectrum sunscreen, so that will cover visible light as well. So that would be better.
Mm-hmm. And I prefer aqua or the gel
Yes.
formulations. Yeah, for oily skins, yes. Okay. So, which skincare ingredient do you swear by personally? Apart from sunscreen, as I understood that you
Yeah.
are obsessed with
Yes, yes,
sunscreen.
true. I think um, if personally, I think topical vitamin C containing serums,
Okay.
they're better.
Okay. So, how does it help? Like brightening skin or
Yeah, it
depigmentation?
helps for depigmentation also. It just helps maintain like for
Mm-hmm.
fine lines, aging. So it maintains the skin health, and vitamin C is more absorbed through through the topical route only through skin.
Mm-hmm.
So I think that is
Okay.
much better option.
Okay. So, another question with the same thing. So, I just want to ask this. Like, does retinol helps? Like topical retinol creams which are going on in the
Yes.
market. Like, should we start using them in our 20s?
Actually,
Like late
yeah,
20s?
not in nowadays. Like I feel even teens are using it, you know.
Yes,
So
teenagers are
yes,
using it.
so it's
Yes.
like it definitely helps in aging. When particularly when a person has fine lines or like early wrinkles.
Mhm.
But the major like major thing again, I have to say is sunscreen only, because I personally I don't
Yes.
use retinol. And so
Okay.
sunscreen is something it's the first and foremost thing. Anything else comes after sunscreen. So
Mhm.
depending upon your
Yes,
concern, you
true.
can go for retinol.
Yes. Okay, so must like most common question your friends ask you as a dermatology resident, apart from asking for the free
Free
samples.
samples, they're always number one. I think they always ask about mainly regarding the same retinol, or majority they'll
Mm.
ask regarding acne. Even if they get one breakout,
Okay.
they get panic and they just immediately ask what I should do. So this is something they keep on asking.
Yes, yes. So yeah, acne are like I fear them
Yeah.
also. So it's like even one is there, okay. Yeah, because everyone has that
Fear.
during like these
Yes.
days during a teenage. So yes, somewhere it defines confidence according to me. So I had one, so I was like, okay, everyone is just staring at my acne, which is not true
Yeah,
actually.
yeah, yeah.
But it
That's
happens.
the
It
problem with
somehow sabotages
dermatological
your
conditions.
confidence.
Actually, they affect our quality of life a
Yes.
lot. So even though we think it is just a superficial or something that will go away, it adds a lot of morbidity, and it really affects our quality of life. So
Yes, it does. It does. I've seen people going from a small acne grade one to cystic ones.
yes,
I've seen them,
even
yeah, and it
scarring,
it, it affects
that's the
them.
most
Yes, the
problematic
scarring.
complication.
As we are talking about scarring, so what is your take on like the laser treatments that are going? Do they help? Like the CO2
Yes.
lasers that I'm seeing people are
Yes,
using for
they do help, but
scars.
not 100%. They help about 70 to 80%. There's definitely an increase, and like in the texture of the
Mm-hmm.
skin, it gets better. So you need the right modality of treatment, which will be selected by the dermatologist actually. So for there are different types of
Derma
scars.
roller comes into the same category. Derma rolling, people prefer
Yes,
derma rolling for
yes. So
scars
that's
also.
what. So it depends upon the types of scar they're having.
Mhm.
So initially, you can also go for a derma roller, but definitely laser is superior. CO2 laser is superior.
Okay. Okay. So, one patient case that you will never forget.
Yes,
That's
yes.
another question.
One pemphigus vulgaris female patient. So she
Yes.
came in a very bad condition in my first year. So now she is
Mhm.
completely all right with only one mucosal lesion.
That's good to hear.
She's completely all right, and she comes for follow-ups. And whenever we meet, she gets tears because we have seen her in a very bad condition, and she got improved very well because of like multitude of reasons, all the medications, the care,
Yes.
and even her compliance also, and even her spirit, because pemphigus is very disease with a lot of morbidity and mortality as well. So
Yes.
that
Yes.
just
Yes.
gives me a lot of hope to myself that life is not about only books or anything. This is something we have to
Yes.
look out for.
You're putting like the spirit of life into people
Yes.
again. So that somewhere it boosts you up to pursue these things. Like that's why it boosts you to be a doctor and
Yes.
just grow and to help more. So yes. So last one question that I want to ask is if you can specify dermatology in one word, what is it for
I
you?
think dermatology is very intriguing. So the more you know, the more things you discover, and there's a lot of things coming up in the field. So it's definitely intriguing.
Okay. So before we wrap up, is there any one golden piece of advice you'd like to give to the students who are considering dermatology in the future? People like me, PGs around the corner.
Yes.
So people who are preparing for it and considering dermatology as their
Yes.
future. So because what I've been hearing, so okay, dermatology has been saturated. There is no future in that. There are no vacancies.
Yes.
So is there any advice you want to give to those people?
Just you have to be you have to dedicate yourself to the branch. After you've chosen it, you are into dermatology, you have to dedicate yourself in improving yourself and becoming that dermatologist. So from day one you should be visually you have to able to pick up the cases, and you should dedicate yourself. That is the, I think, the only advice I would like to give. More than competition or all that doesn't matter if you are having the worth, and so just increase your what you can do. So be dedicated and learn it with your heart.
Yeah. Competition is
Yes.
everywhere and every branch is saturated. There's so many doctors out there, and if you're capable
Yes.
of doing good, so I believe you will
Yes.
do good.
True.
There's
Very true.
no nothing like okay, we have to choose something else just because that this is saturated.
Yes.
Every
Every
branch is
branch
there
is
are so many
saturated.
doctors out there.
So that's
Yes,
right.
it is. Like there's so many doctors out there, and we just have to prove that why we are
Yes.
better than
True. Well.
others. So it's always in you. If you study hard, if you work hard for your dream, or if it is your passion, I believe you will succeed. Dr. Karishni, thank you so much for sharing your journey with us. It was delightful. And you somehow gave a disclaimer to all the students who are thinking to pursue MD dermatology, because I believe this is something that everyone wants to look after before joining anything. I wonder if I should be getting a disclaimer before joining my MBBS. So it somewhere helped actually. It will help students somewhere. So, yeah. So, thank you so much for sharing it with us, and we are very delightful to have you. And for our viewers, I hope you enjoy this. Until next time, keep learning and keep growing. This is Dr. Himanshu signing off from DigiNerve podcast. Thank you so much, Dr. Karishni.
Thank you so much for having me.